Let us welcome Dr. Robert Johnson.
Thank you. That's okay. Okay, can you hear me okay back there? So first of all, like everyone always says, thank you for coming out, because I was a little bit worried. This is the very last session of the whole conference, I think. I'll just introduce myself briefly here, because this talk is going to be mostly kind of autobiographical. It's kind of just, the take-home message is going to be, it's all about the way we think about these problems, right? So, you know, I'm going to tell you what I think, but more importantly, I'm going to tell you why I think that and how I think about these things. So basically, my story that I always tell people is, you know, I went to dental school, right? And I became extremely frustrated by the fact that it was impossible to learn anything there. And so I started reading textbooks and hanging out with different specialists and asking them questions. So I thought I had figured some things out. And then I got to Salmon Arm and bought my practice and started seeing people in the real world, and soon realized that I still didn't know jack squat about anything. And what always bothered me was that there's a lot of people that have gone to the dentist every 6 months for 40 or 50 years, and they've spent a lot of money on crowns and root canals and bridges and partial dentures. And it's just, I always call it a slow motion train wreck. There's no prevention that goes on, right? So that was really bothering me. So then I went out for coffees and lunches and beers with a bunch of the older dentists in Salmon Arm, and I said, how the hell did you guys do this for 40 years? Because I'm not putting up with this. And it, you know, they kind of told me, well, you know, you just have to grow up and realize that people are coming to you with a problem, but it's their problem, it's not your problem, and you didn't create it, and your job is just to try to help them out and do the best you can. And at the end of the day, we're just buying time. That's really all we're doing. So again, I call that a philosophical problem, right? I didn't agree with that philosophy. So I was always walking around saying, there's got to be a better way, there's got to be a better way, there's got to be a better way. And now I believe that there is, and that's what I want to talk about. But before I do that, I have to give you a little bit of a warning, because I don't know if you guys are familiar with The Matrix, but there's a scene in The Matrix where you have to decide, do you want the blue pill or the red pill? And the blue pill is, you go back to sleep, you forget this ever happened, you go back to your normal life. The red pill is you go down the rabbit hole and you make this paradigm shift that we're going to talk about, and you look at things totally differently and you can never go back. So if you're prone to anxiety or depression, I suggest you take the blue pill, because my version of the truth in my mind is depressing. So my goal is, like I've said already, is to create a massive paradigm shift in the way people think about healthcare. And I wanted to put some emphasis on the word think there, and there's a really interesting TED talk by a 12 or 13-year-old autistic kid named Jacob Barnett, and I think it's titled Forget What You Know or something like that. And he talks about how you know, Newton was at university during the plague, and so he had to hide out in his mother's attic, and but he had some problem that he was working on, and so in the process he created Newtonian physics and calculus. And then Einstein was obviously a Jewish guy in Germany in a time when he wasn't able to get a job at university. So he's in a patent office and he's just thinking about things, and he comes up with the theory of relativity and completely revolutionizes physics. So his whole point of his whole talk was, for the next 24 hours, I don't want you to try to learn anything. I just want you to think about things. Use your own creativity and try to solve some problems, right? So that's what we're going to talk about here. So what I'm actually going to talk about is what I think are some issues with what I call conventional orthodontics. I'm going to tell you later why that's in quotation marks. And the potential negative side effects, which I think are not potential, they're certain. Then we're going to talk about a better alternative that's based on understanding and addressing the actual cause of crooked teeth. Then I'm going to spend 2 seconds talking about tooth decay, which is totally unrelated, but I just want to tell you a funny story about that. And then I'm going to talk about some other resources that I think are important. So there's a lot of adjunctive kind of therapies that go along with my main message here, like Buteyko breathing and 8 steps to a pain-free back and baby-led weaning. So we'll talk about that at the end. So first of all, I want to talk about what a paradigm shift actually is. So all a paradigm is, for anyone that hasn't thought of this before, it's like a lens, it's a filter, it's the perspective that you use when you look at things. And so this is a quote actually from The 7 Habits of Highly Effective People by Stephen Covey. And the thing I want to emphasize here is the part where it says, almost every breakthrough in the field of scientific endeavor is first a break with tradition, with the old ways of thinking. So that's there's a There's another quote that my wife heard somewhere that says, half of learning is learning, and the other half is unlearning. And the unlearning is actually more difficult because every mile the wrong direction is a 2-mile error. So, so I'm hoping that I'm going to convince you that there's some errors with the old ways of thinking. So this is a slide that often is accompanied by some quote about just because you disagree with somebody doesn't mean they're wrong. And it's an interesting world we live in now because, you know, there's kind of this, we're like in this post-truth world where people think everything's just subjective and it just depends on your perspective. And so, you know, obviously this guy's over here and he thinks that looks like a 6, and that guy's over there and he thinks it looks like a 9. So what you need to do, he needs to walk over there and see that it actually looks like a 9 from over there, right? And the actual truth is that it's a sideways 6, right? So, but what you can't do is you can't walk up and say, that's an 8, because then you're an idiot, because that's obviously not the case. So I put this in here as well. This is just another example. Has anybody not seen this before? No, everyone has? Okay. No? Okay. So for the people that haven't seen it, who thinks that that looks like an old woman? Does anyone think it looks like a young woman? Okay, so this is the same thing, right, where it either looks like an old woman or a young woman, depending on how you look at it. And so you can actually prompt people. Like I could have given this half of the room a picture of a young woman and this half a picture of an old woman, and then you guys would only be able to see the young woman, or however the hell I said that. But so it's just another example of the same thing. But the reason I put this in here is because the other interesting thing about it is if you look at the old woman, she's got this super giant hook nose and dished in face, which we're going to talk about. And the young woman has a much nicer jawline and a much nicer profile. It's much more attractive. So I have a whole series of quotes here just to, again, establish the framework of how I want you to listen to the rest of this. So this is an Einstein quote that most people have probably heard, right? We can't solve our problems with the same thinking we used when we created them. There's a couple other Einstein quotes that I think are lesser known, where he says, I'm no smarter than anybody else. I've just spent more time thinking about the problem. And if I had an hour to solve a problem, I would spend 55 minutes understanding the problem and 5 minutes coming up with solutions. So to me, the big issue is that people don't understand the problem. They haven't spent enough time understanding the problem. By the way, sorry, I have to backtrack. I forgot to mention in the introduction that I'm a huge fan of a guy named Jim Rohn. I was once accused of being a Jim Rohn evangelist on an airplane. So, because I always ask like 56-year-old people if they've ever heard of Jim Rohn, and they usually say no, and I say that's what's wrong with our society. And so one of the things that I like about Jim Rohn is he says, don't be a follower, be a student. So he says, I don't claim to be the world's leading expert on anything. I'm not asking you to take my word for this. I'm just asking you to listen to it, listen to me, listen to other people, think about it, and reach your own conclusions. So I forgot about that in the intro, so I apologize. So the next thing that you need to understand is that what gets us into trouble is not what we don't know, it's what we know for sure that just ain't so. And again, this comes back to if you've learned something in the past and you believe it and it's wrong, that's a problem. And you're going to have to deal with that if you want to make this paradigm shift. So this is another interesting quote that I heard that I thought was really cool. All truth passes through 3 stages. First, it's ridiculed. Second, it's violently opposed. And third, it's accepted as being self-evident. And I don't understand why you need those first 2 stages. But I also thought about that and I said, well, actually, first it has to be like acknowledged, right? Because you know, there's a Gandhi quote that says, first they ignore you, then they laugh at you, then they fight you, and then you win. So again, it's the same idea. You know, we have to figure out what the actual truth is. This is the last one, I believe. This is kind of redundant, but I just put it in there because I thought it was funny. It's the same idea, right? You have to make a paradigm shift. You have to break with the old ways of thinking. But the next issue you have is this. So this is called the law of diffusion of innovation. Is anyone familiar with this? So what this is just a model where it says that 2.5% of people are innovators. So these are the people like Einstein, Bill Gates, Steve Jobs, Elon Musk, the people that actually come up with new ideas and change the world, right? The next 13.5% are early adopters. So they don't come up with the idea themselves, but they're willing to take a chance on it and try it out before it's proven and safe to do so, right? And then you get to the early majority, the late majority, and the laggards. I saw this in a Simon Sinek talk, and he said, laggards are people that the only reason they don't have a rotary phone is because they don't work. So you're never going to get to the laggards. But the concept of the tipping point is you have to get to 16 to 18% penetration until you get the early majority on board. And I'm pretty confident that the public is further ahead on this curve than the profession. And so that's a problem for us. So let's look at why conventional orthodontics is so bad for people. So this is a quote, I believe, from John Flutter when I was at a thing in Chicago. So he says, a child with crooked teeth is a sick child. Crooked teeth is a symptom of poor health. So this goes along with, we're going to talk a lot about this, but basically it's another one of these things where the crooked teeth that people are walking in with is not a disease. It's a symptom of an underlying issue that has a lot of ramifications. So what I want to do is I want to show you some stuff from the orthodontic literature that is not very favorable for orthodontics. So I don't know the year of this study, but this was so I think the history of this, I'm not even sure about this, but I think the history of this is that back in maybe the 80s or 90s or so, there were general dentists that were saying, you orthodontists are ruining people's faces, and there's a better way. We've got these functional appliances, and we're trying to treat children earlier and encourage mandibular development. And so Lyle Johnson did this study where he showed that actually both groups are creating a moderate midfacial dentoalveolar retrusion. And so I got these slides from Bill Hang. Some of you may have heard of him. And I was talking to him about this because he was helping me prepare for this. And he said, I completely agree with that statement. The only slight issue I have is the word moderate, because I wonder how badly you have to damage somebody's face before it becomes severe. So this is his next slide where he uses to illustrate this concept. We tied, right? Like, we're both doing a terrible job, so congratulations. So this is this is from Angle. Some of you may be familiar with this. This is 1981. Keep that in mind. So it says here, so this is about class 2 cases, right? And he says only a small percentage of cases had maxillary skeletal protrusion relative to the cranial base structures, which actually I'm going to show you later that the standard he's using to determine that is not correct. So actually there are no cases that have maxillary skeletal protrusion. But then he says mandibular skeletal protrusion was the most common issue. And then he says maxillary skeletal protrusion is not a common finding. In fact, more cases of maxillary retrusion were observed. Thus, it appears that designing the ideal treatment regime, those approaches which might alter the direction of mandibular growth could be more valuable or something. But the interesting thing about that is if you look at it, he says maxillary retrusion is actually more common. So it's both jaws are retruded. So maybe the ideal treatment would actually be to develop both jaws forward. My wife was recently at a course where the speaker was talking about some stuff from the orthodontic literature that was not very favorable. And so this is actually from the AGO-DO in March of 2015. I couldn't get the slide to work properly, so I just put this on a separate slide. But these are the conclusions of this paper. Thus, it is fair to say that orthodontics has been more technologically driven than biologically or scientifically based. And as we honor the patriarchs of modern orthodontics, we await the arrival of a mother or father of a new and more scientifically valid paradigm for a profession. So that's right out of the American Journal of Orthodontics in 2015. So that's why, I said at the beginning, the reason I put conventional orthodontics in quotes is because I always say that if you actually look into the history of orthodontics, there is no such thing as conventional orthodontics, because the pendulum is constantly swung back and forth on extracting teeth or not. There was headgear, there's TAS, there's Invisalign, there's functional appliances, there's all these different things, and the only thing that's kind of been consistent is a lack of scientific or biological validity of it. So I want to look at an example of somebody that I call a victim of conventional orthodontics. You may recognize. So if you look at me from the front here, Does anyone see anything wrong with that? Does that look relatively normal to you? So that's the problem, right? That's not what a normal human being is supposed to look like. So if you look from the side, it's more obvious, right? My whole life I've always had horrible posture, no chin, a giant nose, a sloped forehead. And I always say that I just felt like that was the hand that I was dealt, because you can't be a charming, hilarious genius and be good looking, because it wouldn't be fair, right? But so what ended up happening was I read something online about posture, and it said that if you have good posture, you can stand with your heels, your butt, your shoulders, and your head against the wall. And so I stand against the wall, and my head is super far away. And this is after I already started doing something with the sagittal appliance, so I look even more ridiculous. But when I try to shove my head back to the wall, I think I may have been trying to actually bite on my back teeth there, but when I try to shove my head back to the wall, my lower jaw, my mandible wants to jut forward, right? So it's pretty obvious that there's some kind of a connection between your posture of your mandible and the posture of your overall body posture. So I started cursing my orthodontist and saying, what dipshit would have set me up like this? And then 2 weeks later, one of my wife's classmates from dental school was visiting, and he said that he was about to go and take a course on something called orthotropics, which was in 2 weeks after that in Los Angeles. And so I decided I had to go to that. So I'm going to talk about that in just a second, but basically the issue is we're not just treating teeth, right? The teeth are part of the jaws are part of the head is part of the body. They all function harmoniously with one another in health. So yeah, we're not just treating teeth, we're treating a body. If you put the teeth in the wrong place and you hold them there, you cause compensations in the TMJ, the C2, C3, and the lumbar spine. And so I always tell people, if you have nothing better to do on a Saturday night, I actually read the textbook of contemporary orthodontics. Just flip through that and pay attention, because there's a lot of before and after photos in there, and in almost every single after photo, if you look at anything besides their teeth, their head is further forward and it's tipped back and their mouth is open, because that's now how they have to try to breathe for the rest of their miserable life. So it turns out that breathing is kind of important too. So this is a CT scan of me. So this is my airway back here, quite restricted. This is just another cross-sectional view. So there's a whole bunch of stuff, and we're going to touch on this briefly about, it's not all about the size of the airway, right? It's also how you're using it. If you have proper nasal diaphragmatic breathing and you're not moving too large of a volume of air, it's not necessarily going to collapse if it's toned properly and stuff. But it'd be nice to have more than 2 millimeters when it should be closer to 20. So I put this in here just as a little transition. So I always say, if there was one of these about orthodontics, it would say, these braces are going to temporarily straighten your teeth, but then it causes so many other issues that you're going to wish that you had never done this. So this is a quote I got from a guy named Kevin Boyd. I'll talk a little bit more about him later probably. But what he says here is, as is the case with all Western diseases, so SDB and OSA are sleep disordered breathing and obstructive sleep apnea. And some people say the better term is breathing disordered sleep, because it's not a sleep issue, it's a breathing issue. Was anyone at Tom Colquitt's lecture yesterday? So yeah, so he said, what did he say about, he said any organization with the word sleep in it should just disband. Like he was talking about the American Academy of Dental Sleep Medicine or something, and he's like, it's not a sleep issue, it's a breathing issue. So, so this, I believe, is also John Flutter says, establishing nasal breathing is the most important thing you can do to improve your health. 90% of children diagnosed with asthma don't have it. So I saw him say that at a conference in Chicago, and there was another speaker there who was actually an intensivist or an internist or something. He actually used to be a neurosurgeon in England, but he got pissed off with the way their system worked and he came over to the States. And he had this slide where he was talking about what I'm going to talk about next, which is chronic hyperventilation. So when you're breathing through your mouth all the time, when your mouth is always open, and you're under chronic stress and everything, because we don't know how our minds work, you're chronically hyperventilating. You're breathing off too much carbon dioxide, and that screws up your physiology. So he walked you through how this works, right? He had the slide where he's showing the blood pumping around the body, and he says, first thing, I think you get high blood pressure, and so you're put on medication for that, and then you get issues with your kidneys, and you're put on medication for that, and then you get issues with your liver, and you're put on medication for that, and then you get issues with your guts, and you're put on medication for that, and then you have erectile dysfunction, you put on medication for that, and then you're 45 years old and you're a walking pharmacy. And he basically filled up the entire slide, and then he still had the upper left-hand corner open, and he said, now, women, you cannot diagnose a woman with sleep apnea. They're a different species from a different planet, so that's illegal. So they instead get diagnosed with depression and anxiety and chronic pain and chronic fatigue and fibromyalgia and all this stuff. So that's the next slide here is the symptoms of chronic hyperventilation. So, so you can correct this by, there's a technique called Buteyko breathing. I've seen a guy named Patrick McEwen speak on that a few times. And he had a whole bunch of books about asthma and anxiety and health. And he said, you know, people just aren't interested in this message. So then he wrote a book about athletic performance called The Oxygen Advantage, because people are more interested in that. And then he said, if I can't get enough traction with this, my next book's going to be about sex. Because, so all of these things, right? Shortness of breath, fatigue, dizziness, IBS, exercise intolerance, restless sleep, depression, headaches, a lot of those can be related back to improper breathing. So I put this in here because I think it's funny, but I also think it's wrong, because I think the right answers are actually simple, if that makes sense. I think we're constantly trying to overcomplicate everything. Tom said that a few times yesterday too. He's like, it's all about nitric oxide and carbon dioxide. I mean, that's it. It's that simple. It's not that simple, but it's that simple, right? So what's the better way? So this is, I briefly touched on this earlier. There's an alternative treatment that some of you may have heard of called Biobloc Orthotropics. So this was put forth by John Mew in the 60s or 70s. And basically what he realized was that our ancestors, for almost 200,000 years before the industrial and agricultural revolutions, didn't have these problems, right? They had 32 teeth. So I always tell people a human being is supposed to have 32 teeth. And in order for that to happen, if you think about it, if you look at a 2-year-old child, they have 20 teeth and they go all the way to the back of their mouth. So if you're going to have room at the back for 3 more molars, and actually John Mew claims you're supposed to have 1 centimeter behind your wisdom teeth, so that's 4 centimeters of forward development that you need to have as your face is growing. And we don't get that because we don't breastfeed for long enough. We transition to solid foods too early and totally wrong. We have allergens. Our baby furniture is poorly designed, so we put our kids in these goofy ass positions when their neuromuscular systems are developing. So essentially, at the end of the day, the growth and development of your face is messed up, right? And so all this says is that our diets change so much. We have our mouth open too much of the time. It screws up the growth and development of our face. And so this is where I said that when McNamara was talking about the maxilla is not too far forward very often, but it is sometimes. This is what John Mew has put forth as he calls this a proposed Paleolithic profile norm of an 18-year-old person. So this line right here is the McNamara vertical. It's perpendicular to the horizon and the whatever. But you can see that, so this is where he thinks A point should be, right? Which is nearly 1 centimeter back of where John Mew says it actually should be. So no one has a maxilla that's ahead of that. And so this is another representation of, you're supposed to look like the guy on the left, but most of us look like the guy on the right. And so it's a very simple concept that the tongue is supposed to live in the roof of the mouth. You're supposed to keep your mouth closed, you're supposed to breathe through your nose, your tongue is supposed to be in the roof of your mouth, so that as your face is growing, the tongue forms the maxilla. So it's really interesting because if you read the textbook of contemporary orthodontics, they basically talk about everything that orthotropics is based on. There's some of you are probably familiar with Harvold's monkey experiment where he plugs the monkey's noses and it forces them to breathe through their mouth and then they end up with malocclusions. He talks about how there's these Australian Aborigines that have a more hunter-gatherer type of a lifestyle and they've all got 32 teeth. And the most insane one to me, because it's so obvious, is they talk about what they call the functional matrix model of growth, which is that all of our skull is intramembranous bone. And so as your brain grows, it puts pressure on your skull, causes your skull to grow. As your eyeballs grow, they grow your orbits. But then for some bizarre reason, they say there doesn't seem to be a similar mechanism that could function in the jaws. And it's like, that's a little bit interesting because you have a tongue in your mouth, right? And your maxilla has a few sutures in it. And people that actually have 32 teeth and properly developed faces have a maxilla that's the exact same size and shape as their tongue. So I don't think you have to be Sherlock Holmes to deduce that there is a mechanism that works that way. So anyways, again, all this is demonstrating is the tongue is supposed to be in the roof of the mouth. If that happens, your face grows properly, you have 32 teeth, everything's well. But the lower your tongue posture gets, the more it messes up the growth of your maxilla. So what we should be looking for when we're seeing children is, and again, this relates back to improper breathing and not using your diaphragm properly. Allergic shine, by the way, I wanted to have some pictures of these things, but I made the mistake of Googling crusty red lips. Don't ever do that. So I just said, no, you can look that up yourself. I'm just going to put the words here. But anyway, these are all things, you see this every day in kids, right? They've got allergic shiners, they've got venous pooling under their eyes because their maxilla is deficient, their lymphatics are not draining properly. Flaccid rolled out lower lip, when your mouth is always hanging open, your lower lip folds down. So the crusty lips, bozo lips thing is when they're constantly licking their lips because their lips are dry. The skin on the outside gets irritated and chapped. Accentuated Cupid's bow is the upper lip. When you're having too much vertical growth of your face, your upper lip gets more bent down at the corners. Full cheeks is related to not swallowing correctly, so your buccinator muscles are too active and enlarged. Mentalis strain and lip closure, again, if you have your mouth open all the time, then when you try to close your lips, you have to engage your mentalis muscle in order to do that. Just watch the kid when they're sitting in a chair and see where they got the lips together or apart. Level of physical activity, I think I'm going to talk about that next, is they can either be tired or hyperactive. Long eyelashes and sound of voice, that's an interesting one. That's kind of like, again, I kind of had this issue. It kind of goes hand in hand with allergies and asthma. This nasal sounding voice and long eyelashes. I don't know if anyone really knows what's up with that. And then tongue posture at rest, again, that's hard to observe if their mouth is actually closed, but if it's open, you can tell if it's in the floor of the mouth or slightly elevated at least. So when you start looking at the health histories of these kids, you want to look at, do they have allergies? Do they have a lot of runny noses, chronic infections? Have they had a lot of ear infections? Because if your eustachian tube is not functioning properly, then you're going to have issues with that. Snoring and obstructive sleep apnea. Children should not snore, period. Like that's, a kid that's snoring has an issue. Again, high or low energy level, attention span. I saw a guy, and Tom talked about this yesterday. There's a pediatric sleep physician named Steve Sheldon. He was at that same conference in Chicago, and he basically said ADHD does not exist. It's a sleep breathing problem. These kids are just tired, and it's a paradoxical reaction to the tiredness, and they become hyperactive. Noisy eating, again, if you're trying to breathe through your mouth and eat at the same time, that's disgusting. Trouble swallowing, that's partly tied to when you're breathing through your mouth, your tonsils and adenoids try to do the job of your nose, which is to warm, filter, and humidify the air, so they get inflamed. So you have these kids where they've got these giant golf ball sized tonsils and they have trouble swallowing. And tooth grinding, again, that's just theoretically related to airway issues. You're trying to maintain a patent airway while you're sleeping, so you're grinding your teeth around. So those are the kind of things, like I said, I think that we need to, I wish I had written down, Tom had this quote yesterday from Ricketts from like the 50s where he talked about how your respiration and mastication are inseparable. Anything that affects one is going to affect the other, and so we basically said we need to do a much better job of recognizing and treating these issues, and the time is now, and that was in 1955. So I think the time is now still. So anyways, that's mostly all I wanted to say about that. I'll touch on that a little bit more in a second, but I just want to spend 2 seconds on tooth decay because a few years ago I was here at the PDC and there was a speaker named Brian Novi, And when the host introduced him, they said, have you ever heard somebody say 9 out of 10 dentists recommend something? And you wondered who the 10th guy was? It's this guy. And so now I always tell people that story because I say, I want you to understand the magnitude of the problem, okay? So I don't know about you guys, but this is the model for tooth decay. This is my crappy diagram here. But this is the model for tooth decay that I learned in dental school, which is you get a cavity because you don't brush and floss well enough, you eat too much sugar, and you don't get enough fluoride. And so that always bothered me because very early on in my career, I had this like 22-year-old nurse come in with impeccable oral hygiene and just had rampant decay everywhere. And then of course there's other people that smoke and drink 2 liters of pop a day and do everything they possibly can do wrong and they don't have any cavities. And I don't know about you guys, but I can't explain that based on that model. So this is, again, my crappy diagram of Brian Novy's alternative model. And I remember in our endocrinology course in school, the guy said, all good diseases have a vicious cycle. So you start with a low, you start with a low intraoral pH, and that's going to encourage, but see, the thing that annoyed me was he didn't say why you have a low intraoral pH, right? I think that is, again, related to mouth breathing and diet, obviously, because, our processed diets that we're eating, messes up our physiology. So, but anyway, so you've got this low intraoral pH. That's going to encourage the growth of bacteria that like a low pH environment. And then that's going to lead to growing bacteria that actually produce acid. And then that's going to decrease the protective commensal organisms. And now you're going to have an overgrowth of carcinogenic bacteria. I'm really curious because I can't believe that I don't know this as a dentist, but how many strains of bacteria actually cause tooth decay? It's like 1, 2, 3 maybe. So if they can't live in your mouth, you won't get cavities, right? So this is how I think you break the cycle. Most importantly, as always, you breathe through your nose. Secondly, you brush your teeth with, he recommended baking soda and an MI paste because he said, fluoride in a high concentration in an acidic environment when there's no calcium and phosphate around is actually not good. So he said baking soda and MI paste. I don't know if anyone's familiar with Riemann, but it seems pretty cool to me. It's got hydroxyapatite in it, it's got xylitol in it. And then he talked about xylitol, and he said there's been studies on xylitol that say it's not effective, but that's because you need at least 5 grams a day, and it has to be in at least 3 separate exposures. So I have this theory that if you got 2 grams 3 times a day consistently, it would change the composition of the bacteria in your mouth, and you wouldn't get any cavities. But I'm worried about whether there'd be any GI side effects of that. So the take-home message is that correlation is not the same as causation. Like I always say that, people talk about how oral health is so important to overall health and, perio and heart disease and all these kind of things. And I say that's obviously true because your mouth is connected to your body, but I personally think that it's a much stronger connection the other direction. And what I mean by that is I think that, healthy people don't have issues with their mouths, right? So I think anything that's going on in your mouth is a symptom. It's not a primary disease. And again, there's a difference between treatment and cure, right? This is where we need to shift the focus from, treatment and management. Like I always refer to the healthcare system as the disease management system, and a poor one at that. It even does a poor job of that. There's a difference between a symptom and a disease, and there's a difference between normal and ideal. So again, I talked about earlier when I was showing my own picture how that's not what a normal person is supposed to look like, right? So Bill Hang has a slide where he's got this little cartoon drawing of kids where there's a skinny kid on the left and they get fatter and fatter as you go to the right. And he said, when I was a kid, normal was over here. Nowadays, normal's over here, right? I looked up the definition of the word normal, and it's just usual, typical, or expected, right? So when you're in a situation where 95% of the population is sick, that's normal. But it's not healthy, it's not ideal, it's not the way it's supposed to be. So there's a lot of people, there's all kinds of Facebook groups about TMJ and TMD, right? And I've heard people start using the term CMD now instead of temporomandibular dysfunction. They're calling it craniomandibular dysfunction. I really like Mike Mew, John Mew's son, came up with the phrase craniomandibular dystrophy because it's poor growth of your craniomandibular complex. Kevin Boyd has recently come up with the phrase craniofacial respiratory complex. Like that's what we're dealing with here, your cranium, your face, and your nose, your respiratory complex. So, but I came up with my version, which I call industrial civilization syndrome. So this is all the diseases that we all have that didn't exist before the Industrial Revolution. And again, for the people that weren't at Tom's talk yesterday, the thing that's always bothered me about this whole thing is, like I said, I think that if we treat children properly, we can actually prevent and cure these problems, right? We can correct the growth and development of their faces, change their diet, change their breathing, get them to grow up properly. But there's a whole whack of people in their 50s and 60s and 70s that are super screwed up already, and what are we going to do about that, right? And so I always run around saying that there's a reason the saying an ounce of prevention is worth a pound of cure exists. And there's a reason the saying the cure is worse than the disease exists. Because, if you're 60 years old and you're missing a bunch of teeth, and your teeth are all ground down and you've got all these issues, it's like, do you really want jaw surgery and reconstruction and spend $50,000 to solve this problem? But Tom yesterday showed some super conservative, lingual frenectomy, myofunctional therapy, Buteyko breathing, this little nighttime pod appliance thing, and he was just showing these amazing results with that. People that had 30-year medical histories of irritable bowel disease and heart attacks and stents placed and quadruple bypasses and high blood pressure, within a really short period of time, most of that stuff gets better if you learn how to breathe properly. But the next issue that we face as human beings is this. Who wants change? Everybody. Who wants to change? Nobody. This again is like Einstein's definition of insanity, is doing the same thing over and over and expecting a different result. The reason he said that is because that's what people do, right? So again, Jim Rohn's version is, for things to change for you, you've got to change. And so I personally think that as a profession, we need to change, right? And so I think I'm getting near the end here. The last thing that I want to talk about is, so these other resources that I mentioned, right? So Baby-Led Weaning is a book about, how to properly, breastfeed kids for long enough and transition them to solid foods properly and let them decide when they're going to do that. 8 Steps to a Pain-Free Back is a really interesting, that's a book and a website and a method developed by a woman named Esther Gokley. I consider it to be the chiropractor, physiotherapist, massage therapist version of Biobloc Orthotropics, because basically what she did is she realized that there's a lot of people that live a more ancestral style existence, and they have much more physically demanding lives, but they don't have all the chronic back pain and everything that we have. And so it's really interesting to read, because she talks about how if you just look at a human skeleton, you can tell how it's supposed to work, right? Your heels are incredibly strong, dense bone, and so they're supposed to support your weight, and the rest of the bones of your feet are very fine and slender. And so if you've got forward head posture and your center of gravity is all shot, then you're supporting your weight with the small bones of your feet instead, and you end up with plantar fasciitis and stuff like that. So it's called 8 Steps to a Pain-Free Back, and I basically say that that's how a human being is supposed to sit, stand, walk, bend over, and lie down, which is only 5 things, but some of them have 2 different versions. So, and then Buteyko breathing I mentioned, that's just about learning to breathe less and breathe through your nose and use your diaphragm. Biobloc Orthotropics we touched on. Oral myofunctional therapy and GoPEX are kind of similar. It's different ways of retraining the oral musculature to function properly. And then I just put on facefocus.com is Bill Hang's website. And the Exceptional Health Company is a guy that we saw speak at a conference in Calgary. His name's Jason Sean Bennett, and he has a book called Eat Less and Live Longer. So he calls himself a self-educated health researcher. He's not any kind of a doctor, chiropractor, acupuncturist. He just was a guy that had a lot of issues as a child. He had asthma and skin diseases and all these issues, and the doctor said, sorry, this is just bad genetics. You're gonna have to take these medications for the rest of your life. And he said, no, not acceptable. So he researched centenarians. There's a few pockets of people in the world that routinely, the majority of them live to be 100, and they don't have all of the chronic diseases that most of us have. But he was looking at it from the perspective of the diet. So what are they eating? You know, way fewer calories, no red meat, no carbohydrates, plant-based, a little bit of nuts and stuff like that. So my main message that I always try to, I'm such a positive, optimistic person, clearly. So I always say there's a better way and we can create it together. So I hope that I've given you something worthwhile here. If you have any questions, let me know. But I want to spend just 2 minutes talking about this. So this is something I did a little webinar about the quality assurance program of the College of Dental Surgeons, and then they sent out a survey about it. And I went on a little bit of a rant on that survey, and somebody contacted me. And so it's a guy named David Vogt, and he's actually on the quality assurance committee. And what he's trying to do is, he believes that one of the issues in not just dentistry, but all of the knowledge professions, medicine, law, accounting, whatever, he thinks that a lot of people have this, imposter syndrome where they feel like they're incompetent and they don't want other people to find that out. And so they don't engage with their peers, and they kind of isolate themselves and live these lives of quiet desperation. So what PeerFX is, it's an online collaborative peer-based learning tool where you can actually just go on there, post cases, ask questions, engage with other professionals. I hope some of you are on some other forums, right? There's a lot of other types of forums out there, but the really cool thing about PeerFX is that you can actually earn CE credits for doing that. So rather than having to travel all over the place to try to get your CE and spend a pile of money and time away from your family and your office, you can spend a little bit of time here and there engaging in this and earn CE credits that way. So he's given me a coupon code because he wants me to try to help him promote this thing. So if you use that code, Robert Johnson Free Basic, then you get a free trial. So you just go to peerfx.com, sign up for your free trial, and check it out. Because I think it's, again, we just had breakfast on Thursday morning, and he said he's starting with dentistry, right? Eventually he wants to expand this into medicine and law and all these other professions, but he wanted to start with dentistry because he had a connection to the college. But he said, maybe this isn't the right profession at the right time, but hopefully it is. So like I said, I encourage any dentist out there. I don't honestly know whether it's open to CDAs and hygienists, but you can definitely send me an email or there's probably something on the website where you can email David about that. So thank you very much. If you have any questions, that's my email address. And I'm a little bit ahead. Well, I was trying to finish in 45 minutes. I had 5 minutes for questions. So any questions?
What's the alternative?
Pardon?
With the orthodontics, what's the alternative? Because you said conventional orthodontics creates these issues.
Yeah.
So, for example, if I have a child and I don't want him to get conventional orthodontics and have all the issues, what's the alternative?
Well, there's a lot. Sorry, I made this presentation about Biobloc Orthotropics, right? That's that to me, from what I've seen, I consider that to be the gold standard, in terms of correcting the growth development of the face. But it's very difficult, and it requires a lot of compliance. It takes a lot of time, and there aren't very many people doing it, right? So there's a lot of other alternatives that I'm less familiar with, like ELF and Crozat and these types of things. And then there's another similar concept called the growth guidance appliance that was developed by a guy named Steve Galella in Tennessee. Again, so this is the problem, right? Is that there are very few providers that are doing these types of things, and so that's why I always say that I originally put this presentation together with the intention of delivering it to the public, because I think the only way that the profession is going to change is when mothers demand better for their children. And so I always say that if I ever succeed in doing that, it's going to create a massive supply and demand problem, right? But I think that that's better than the current problem where the profession isn't on board with this and we're doing more harm than good. So that's kind of why I wanted to speak on this, right? Is because I want to encourage people to look into this stuff and and learn how to do it.
It seems like you're going two different ways though, because whether you call it sleep apnea or a breathing problem at night, that's not getting enough air. But your other thing, you were saying you're getting too much breathing, you're blowing off your CO2, and you're over.
Yeah. So the problem is, it's not your because the issue is the breathing issues at night, right, are a side effect of the fact that you're not breathing properly during the day. So, like I said when I was talking about some people, obviously if you've got a super tiny airway like mine and it's not, it's flaccid, then that's easily going to collapse when you're trying to suck air through that thing, right? But theoretically, if you're breathing properly, you're not moving a very large volume of air. So, there isn't that issue that's going to cause it to collapse. But the other issue is when you're breathing too much and when you're chronically hyperventilating and when you're breathing off too much CO2, that messes up your physiology and it doesn't allow the gas exchange to happen in your blood for the oxygen to actually get to your tissues. If that makes any sense. I didn't talk about any physiology in there, but yeah, do you remember the Bohr effect, like that S-shaped curve of oxygen binding to hemoglobin and pH and stuff like that? So it's, yeah, the issue is your airway you're obstructing at night when you're sleeping because you're trying to suck too much air in and your airway loses its tone and it's too small, right?
And Tom also talked about nitric oxide as well, produced in the peritoneal sinuses, supposedly, I don't know anything about it, developed, he mentioned Baylor University, Nobel Prize.
Yeah, I think 3 people won a Nobel Prize for discovering
this.
this.
I didn't know about this, but supposedly nitric oxide is carried into your lungs by nasal breathing, which increases oxygen transfer to red blood cells, and so that's why nasal breathing is also indicated.
Mm-hmm.
I don't know anything about that.
Yeah, this is a massive topic, right? I was actually really, because Tom, he's like, I've been doing this for 50 years and I've learned more in the last 5 years than I learned in the first 45. And so that actually just completely blew me away because the amount of stuff that he must have gone to so many conferences and courses, and like he said, he's getting so old, his brain is full, so he has to think in PowerPoint slides. So every time he learns a new idea, he makes a slide about it. And but yeah, it's just a massive topic, right? You have to. I can't answer that question properly. I guess if what I've said so far doesn't make any sense.
No, it does, because when you breathe your nose, you have CO2 level higher, you have the nitric oxide higher. It's all produced in your sinuses, and it is, both gases are very important because they have vasodilation impact on both as well as CO2 is very important to release oxygen to the tissue. So it's always very close to your lungs.
Yeah, like Tom was talking about how, all these people that are into sleep medicine, like they're always measuring the oxygen saturation, right, and the desaturations, and he said what's probably more important to look at is the end tidal CO2, like what concentration of CO2 is left behind in your blood after you finish breathing, or your lungs, or.
So that's why people are lightheaded when they are in anxiety. They breathe their lungs all the time, so they lose a lot of CO2. So there's no oxygen to their brain, and they feel like collapse. That's very simple. They keep them in the bag to breathe into the bag. You increase CO2 in the bag, they breathe it in, and then they feel better. So it's very simple. It's just basic physiology.
All right, 20 seconds. Any other? Okay, thank you.